talked about the main symptoms of schizophrenia, its course and its prognosis. In this video, we shall talk about the management of schizophrenia. Schizophrenia can be managed by two main modalities, medication and psychosocial interventions. Medication is an essential part of the treatment of schizophrenia, as you are already aware of the chemical imbalance that occurs in the illness. The medication hence helps to reduce these imbalances. The doctors usually start medication after obtaining your consent, weighing the risks and benefits of choosing a particular medicine. These medicines are usually started at low doses and are gradually increased to effective doses while monitoring for improvement and adverse effects. The medications take time to show its effects. It may take around 1 to 2 weeks before you start to notice the improvement. The doctors take necessary precautions to prevent or to reduce the side effects. It is not uncommon to have side effects such as tremors, stiffness, increased salivation, sedation and weight gain. If you notice such effects, do consult your doctor at the earliest so that appropriate measures may be taken to reduce the same. During your regular follow-ups, the doctor may advise some blood tests to look for any additional side effects such as raised blood sugars, increased cholesterol levels, etc. These may be detected early and necessary interventions may be planned. It is also important to note that the side effects are usually transient and not life-threatening. Psychiatry has a range of medications for the treatment of schizophrenia. If one develops side effects to one drug, a different drug can be chosen. The duration of treatment varies from patient to patient. For some patients, the medication is to be continued for a year, and for some, it can be 5 years to lifelong. Commonly, family members tend to stop medication once the symptoms improve or when the patient has side effects. This practice is detrimental and can cause a relapse, which may further increase the duration for which the medications have to be continued. The decision to stop medication has to be chosen by the doctor after reviewing the course of illness and discussing the same with the patient and family. You may periodically check with the doctor regarding this. Despite being on medication, sometimes patients may have worsening of symptoms due to concurrent substance use, any stress in the family or his personal life, not sleeping adequately, etc. In most cases, patients maintain well on medications. Hence, it is advised that the patient and caregivers keep the above in mind and take necessary precautions. Discontinuing medication without consulting a doctor is not at all advisable. There is a high chance that patients will experience a similar illness again. There are also chances that medications that worked previously might not work and a trial of another drug is offered. It can be very distressing to the patient and his family members, so it is always advisable to consult with your treating team and opine on the continuation or discontinuation of the medication. Medications let the patient remain free from the burden of illness and thus enjoy a better life. Some side effects might interfere with the functioning of patients. Sedation, which is an essential side effect of the medication, may interfere with driving, working on machinery, etc. Do consult your doctor if you notice that the side effect so that he or she can take care of such issues. Now, despite treatment with medication, there may be specific symptoms which do not completely improve with medication alone, such as difficulties in concentration, lack of motivation, problems interacting with people. These symptoms additionally need interventions such as training, counseling, and psychoeducation. Psychologists, psychiatric social workers, and psychiatric nurses work as a team along with psychiatrists to help patients and family members handle these situations. The answer is no. Marriage does not cure schizophrenia. Marriage of patients with schizophrenia is in fact a complex issue, and the decision regarding it should be taken after consideration of multiple problems. The disorder and the medications given for its treatment may alter the sexual desire and performance in both men and women. Fortunately, in most cases, doctors will be able to address these issues. The ability to beget children is not seriously affected in these patients. However, women who are receiving medications should discuss their plans for conception with their psychiatrists, as some medications will have to be avoided during the early months of pregnancy. They may suggest alternative treatments. Most medications are safe in pregnancy and lactation. However, doses of medications have to be adjusted through pregnancy and delivery. They will have to be in constant consultation with their psychiatrists. The patients and their families should carefully think about whether the patient is able to have a meaningful relationship with his spouse and the new family. Most importantly, he or she should be asymptomatic, as marriage can be stressful, especially when the patient has to move to another family. There may be chances of relapse. The family should have reasonable confidence that the patient will be able to handle the stress. The other issue is the ability of the patient to lead an independent life financially. A common question is whether the children of the patient will develop schizophrenia. As schizophrenia is caused partly by genetic risk, the risk for children of persons with schizophrenia is higher than the children of those who do not have the disease. The risk is estimated to be about 10%, that is, about 10 times more. Seen from another perspective, there is about 90% chance that the children of patients with schizophrenia do not develop schizophrenia. Unfortunately, it is difficult to predict whose child may develop schizophrenia. All these issues are important considerations for the would-be spouse and his or her family too. Both parties must discuss these issues before the marriage. However, this does not happen, and the families get patients with schizophrenia married without disclosing the illness. The consequences of such actions on the patient's disease and relationship are highly unpredictable. Engagement of family members and the community in providing support is significant for the recovery of the individual. All efforts should be made to reintegrate the patient into society to lead a productive and fruitful life.